For millions of individuals suffering from severe osteoarthritis, advanced knee degeneration can make everyday activities increasingly difficult. When conservative treatments no longer provide sufficient relief, knee replacement surgery may become an effective treatment option. Today, patients are often introduced to two approaches: traditional knee replacement and robotic-assisted knee replacement. Let's begin with traditional knee replacement. This procedure has been performed successfully for decades. During surgery, the orthopedic surgeon removes damaged bone and cartilage and positions an artificial implant to restore joint function. Surgical guides and established techniques help the surgeon achieve proper alignment and balance. Traditional knee replacement remains a highly successful and widely used procedure around the world. Now let's look at robotic-assisted knee replacement. It is important to understand that the robot does not perform the surgery independently. Instead, it serves as an advanced tool controlled entirely by the surgeon. Before surgery, detailed imaging is used to create a personalized 3D surgical plan. During the procedure, robotic technology assists the surgeon with real-time guidance and precise measurements. This may help improve implant positioning and surgical accuracy in selected patients. Some studies suggest potential benefits in early recovery and patient satisfaction, although outcomes depend on many factors. Financially, robotic orthopedic surgery can increase treatment costs in many Western countries. This has encouraged some international patients to explore treatment options in India. JCI-accredited orthopedic centers in India offer advanced robotic-assisted joint replacement technologies, internationally trained surgeons, and modern rehabilitation programs while providing advanced orthopedic care at significantly lower costs. Ultimately, the right choice depends on your anatomy, overall health, surgeon recommendation, and treatment goals. Always consult a qualified orthopedic specialist and undergo a detailed evaluation before making treatment decisions. Knowledge is your best tool when protecting your mobility. Subscribe to Cure in India for more honest, data-backed medical insights and healthcare guides.